This segment is paid for by Spectrum Health. Spectrum Health is one of the first hospitals in Michigan to offer a novel treatment for emphysema. The treatment uses the Zephyr Valve system, an FDA-approved minimally invasive procedure requiring no incisions or cutting. Dr. Gustavo Cambunocelli, Spectrum Health interventional pulmonologist, is here to discuss emphysema, chronic obstructive pulmonary disease, also known as COPD, and this new treatment. Thanks so much for joining us this morning.
Thank you very much for the invite.
Absolutely. So, doctor, can you tell us a little bit about emphysema and COPD?
Thank you for that question. Emphysema is a condition that stems from destruction of the lungs, whether it's genetic or secondary to tobacco smoke. Unfortunately, our patients are rendered impaired to breathe. There are different types of emphysema and COPD and bronchitis. Although in the most severe forms, patients really cannot breathe, they cannot do much of what they really want to do. And we at Spectrum Health provide them with a very convenient procedure in which there's no cuts, and we hope to let them breathe the way they want to.
And you kind of just mentioned tobacco smoke, but what are the other causes and the current treatments, I guess, out there for emphysema and COPD? It's not just tobacco smoke altogether. You said some people can be born with this?
It can be genetic. There's some conditions that can translate into emphysema. Unfortunately, a few years ago, we didn't know better, and some of our workers were exposed to very toxic fumes. And unfortunately, they're rendered disabled from that type of toxic exposure. But by far and large, tobacco smoke accounts for the majority of emphysema, COPD in the country, which is a significant problem. Patients spend a lot of time in the hospital, a lot of money on medication, and it's the third leading cause of death in the United States, unfortunately.
Yeah. So this Zephyr Valve treatment, how is it different from the other more common treatments?
Thank you. Usually patients that have emphysema, bronchitis, or COPD conditions, they are starting on some medications, some puffers that they use. They get on oxygen, they use rehabilitation programs, but when their condition gets a little too far out and their lungs get a little too large, they don't have much real estate in the chest to breathe. Therefore, the only options were fairly aggressive surgeries or lung transplantations. The Zephyr Valve is a procedure that takes roughly half an hour. It's done minimally invasive with a scope down their mouth as the patient is asleep, wake up with a little sore throat. And we deploy this prosthesis effectively shutting down the area of the lung that works the least, therefore allowing the other areas of the lung that are a little bit less damaged to do their work. So essentially, we're creating some real estate for the lungs to open and close and take that deep, fulfilling breath that our patients are so much in need for.
So as far as the success stories out there, there's got to be some.
There's a lot of success stories. All the evidence and the research that we've done demonstrate that the overwhelming majority of the patients that underwent this procedure will do it all over again and recommend this procedure to a relative or an acquaintance. There's minimal risks in which we at Spectrum Health have developed protocols that we care for the patient for a couple of days in the house at Butterworth, just to keep an eye on them. But I'm glad to say that it's a very successful procedure, minimal complications, and we're very excited to provide this type of care, minimally invasive, for all our West Michiganders that are looking for options.
That's fantastic. So any really quick sign or symptoms that people need to watch out for when it comes to emphysema or COPD?
Very good question. Unfortunately, emphysema in the earlier stages doesn't give any symptoms. It's like a flat tire that you have a very small hole in the tire. You don't find that until the next day. So patients start developing signs of emphysema early, but they kind of brush it off and no big deal. A little cough, a little sputum in the morning, a little wheeze. With more smoking, more exposure to whatever caused the emphysema, and with age, unfortunately, these signs and symptoms start being a little more felt every day. And when it comes down to the point that they cannot breathe, they cannot do grocery shopping, get the dog out for a walk, climb a flight of stairs, they go to their primary care doctor, they get put on some medications, then they get to pulmonologists, and when things get a little out of hand, then they get to us. Dr. Egan and myself, both interventional pulmonologists, evaluate personally each patient and find out if this is the right treatment for you. And if it's not the right treatment for you, we have many other trials that we're blessed to have at Spectrum Health that we can help patients that cannot breathe very well.
Fantastic. Well, doctor, thank you so much for your time this morning.
Thank you for the invite.
Absolutely. To find out if you qualify for this treatment, call the Spectrum Health Pulmonary Office, 616-504-2988. Again, minimally invasive.